everyone. If you are listening live, you're listening to the WEGO Health Activist Google Plus chat conversation this evening, and you might be listening to us later on YouTube, so welcome. We're excited to be having this conversation tonight. I'm Jenelle Marie. We're going to be talking about your illness and advocating for uncomfortable or taboo issues. So it's kind of a touchy subject, and we have some awesome activists on the conversation with us this evening. First, I'm going to introduce our moderator, that is Danielle Schroth, and she is the community director from WEGO Health. Danielle, go ahead and take it away.
Thanks so much for the introduction, Jenelle, and thank you, Jessica, Gina, and Jenelle for joining us tonight. I'm the community director, and for those of you who've watched our first 3 episodes, you're probably sick of me by now, but I'd like to just jump on and kind of explain why we do this and some other ways for you to get in touch with WEGO Health. So I'll be on for right now, and then at the end for a couple minutes just to sort of help wrap up. So we do these WEGO Health Activist Roundtables as a platform for health activist leaders to have an open forum discussion on topics that they think are important to the community. It's cross-conditional, and really we're looking for people who have opinions and want to talk about whatever the issue is at hand. And I'm very excited to have Jenelle host today because I think we worked with some really interesting talking points, and both Gina and Jessica have, I think, great backgrounds that are different, but really there's some cross conversation topics there as well. So there'll be some great talking points tonight. If you're interested in being part of a WEGO Health Activist Roundtable, you can email community@wegohealth.com. That's WEGO health.com. And you can also get in touch with us on a number of different platforms if you want to be a guest pinner, guest blogger, if you're interested in being parts of one of our insight groups, bucket everything into community@wegohealth.com, and we'd be happy to speak with you. And other than that, I'm going to let Jenelle take it from here, and thank you so much for letting me be a part of it with your conversation, and I will jump back on at the end.
Fantastic. Thanks, Danielle. So I'm going to do a quick introduction about myself and then let you know, like you have heard already, we've got Gina St. Aubin with us, and we have Jessica Gamino, and I hope I'm saying your name right, Jessica, but correct me if I'm totally butchering it. And both of these people are touching on different topics than I am. So as my work is as the founder of the STDproject.com, and the STD Project is primarily a website which helps advocate for people with and without STDs, promoting awareness, education, and acceptance. And along with that role, I'm also the spokesperson for PositiveSingles.com, and then I'm also the STD expert for Answers.com. So everything's online that I do. And we've got Gina. I'll let you go first, Gina. Gina is a special needs health activist, and she is the founder of Special Happens, but I'll let her give a little more detail about what she does in that capacity.
Hi, everyone. Happy to be here. As Jenelle said, my name is Gina St. Aubin. I'm the founder of SpecialHappens.com, and Special Happens really is a community blog, I'd like to say. I have a number of contributors. I contribute myself, and we discuss a variety of issues that are happening today in the world and through our experiences to kind of share what we go through as parents of children with special needs, what our thoughts are, and like I said, different health-related issues that are in the community coming up every day.
Great, thank you, Gina. And then next we have Jessica Gamino, and again, I think I might be butchering that name, so please let us know. And she is an advocate for a couple of different things: chronic illness, autoimmune disease, bipolar disease, along with women's health issues. And she is the founder of the blog Fashionably Ill, and that is by her name, jessicagamino.com. So I thought, and I think that says on the bottom of the screen as well. So take it away and explain a little bit about what you do in that capacity, Jessica.
Thank you, Jenelle. Well, my last name is Spanish. It's it's Jimeno, but that's okay. So it's all right. It's all right.
I totally butchered that. I had a feeling.
That's okay. Yeah, so it's jessicajimeno.com, and I blog about living with 4 very different illnesses. When I was working in mental health nonprofit, I realized that there were lots of resources for people with mental illnesses like bipolar disorder and depression, but there was really nothing out there for people who are also living with a burden of mental illness and 24/7 physical pain, like, excruciating physical pain. And as somebody who had changed a lot because of being on 12 medicines and surgeries, I kind of wanted women out there to feel that they were beautiful no matter what changes they were going through, and that's why I started Fashionably Ill, the Sick Woman Stylist. It's just my name, jessicahimeno.com, and I blog about body image, as well as the tagline is surviving pain with style and humor, and that's really what it's about.
Great.
Oh, and I also blog for, I forgot, I also write for askabipolar.com.
Okay.
Readers anonymously submit questions about bipolar disorder, and we answer them.
Fantastic. Okay, great. I am really excited to be talking to both of you gals. First of all, I do, my topic is obviously quite different than the things that you're activists about, but I have, my father was diagnosed with bipolar, so I have a family member who's near and dear in that capacity, Jessica, and then I also have a nephew who has Williams syndrome, Gina, so I have people that I care about who are in that realm as well, so I think that there's a lot of, no matter what, I just feel like there's a lot of synergies across any kind of advocacy and any kind of issue, any kind of condition that people are dealing with. So that's why I was really thrilled about this conversation, especially that all of us are coming from very different backgrounds, but I think that we're going to find a lot of similarities and a lot of empathetic ways to say, oh yeah, I've been there too, or that makes sense. And so I think our listeners are going to like that a lot. So, okay, so without further ado, I'll recap. We're talking about tonight illness and advocating for uncomfortable and taboo issues, and specifically talking about them, how we talk about them. Is it different than talking about just everyday things, and do we talk about them differently to different people? So we've got a list of questions, but this is more like conversational too, and that's the intent behind it. So we can go back and forth with the questions, and feel free to pop in, if I'm asking one of you a question and somebody else has a thought or opinion, definitely share what it is that's speaking to you at that point in time. I think that's important too. So our very first main topic is, how do you first tell someone about your or in Gina's situation be her son's conditions? So I'm going to let Gina take the first question, and my first question is for Gina. In addition to there's cerebral palsy, your son has also been diagnosed with autism, sensory processing disorder, global developmental delays, and Landau-Kleffner syndrome. So I'm sure at times that's quite the mouthful to tell people. How do you go about approaching that? How do you explain that to others?
The interesting part of explaining his different diagnosis is each one has come it has evolved. So, where we started with cerebral palsy, then it was cerebral palsy and autism, then it was cerebral palsy, autism, and sensory processing disorder, and then, you just kind of add them along as he gathers them up. But I think really the biggest part of it is explaining to somebody in the setting in which you're asked or you're presented the situation to explain it. So obviously, if I'm speaking with a doctor, I talk more in depth. If I'm speaking at school, I'll speak more towards the educational items and how his diagnosis affect him there. And really, I think through his now 11 years that we've been going on this path with him, it seems to be whatever is the most involved diagnosis at the moment, whichever one seems to be the strongest, has the strongest need for us to address, is the one that I usually start out with, and sometimes I don't even add any of the other ones. Sometimes they're not necessary. It just really doesn't matter. And really, I find that that's the best way. I don't really have a stock spiel or anything like that. It's just whatever's in the moment.
Okay, that's interesting. I have kind of similar experience in that because I am living with a long-term STD, so I have genital herpes HSV2, and then I've also contracted HPV and scabies, but I don't necessarily always tell everybody all three of those things, not because I'm worried about the consequences or because I don't want to share it. It's usually if it's relevant, you know, if somebody's talking about, oh, I've had HPV, I've had a colposcopy, so then I say, oh, I have too, and, you know, what was your experience with that? And so I may not go into the rest of the detail. It's kind of more a, how does this relate to the current situation? So I think that that makes sense. Okay, and then so going with that kind of thought, Jessica, for you too, you've got multiple conditions that you're advocating for and that you're dealing with on an everyday basis, from bipolar 2, polycystic ovarian syndrome, asthma, and then sometimes, I know I'm going to butcher this too, the myasthenia gravis, and that can all be described. Okay, well that was close. I did a little better than with your last name. I feel like a lot of those two are what you have even described on your website as invisible illnesses too, so it's not something that's readily apparent when you're walking around or when you meet someone. How do you think that's different, and do you approach that topic differently then, and how do you explain that to others when somebody might not necessarily be aware that that's something you're dealing with on an everyday basis?
Well, I agree with what Gina was saying, context. When it comes to the polycystic ovarian syndrome, I've actually never had a bad reaction to that disease. I think it's because the name of the disease says exactly what it is. It's easy to pronounce, and people can just tell it's painful from the name of the disease. You know, it's just like, whoa, that sounds painful. And you're like, well, yeah, it is. But the bipolar disorder, it is an invisible illness. There are stock reactions that people have to bipolar disorder, and I was diagnosed when I was 18. I'm 30 now. So I've come to learn how to calmly anticipate those reactions. So I was at a party for a friend from high school. It was a baby shower, and our teachers were there from high school, and I was getting ready to speak at a convention the next week. So I was leaving the next day to speak at a mental health convention, and they'd asked me, well, why are you involved in mental health? Why are you working in mental health nonprofit? How do you know about that? And so then I said, well, I have bipolar disorder. And then they were like, you know, it's a shock. But they know me, but all of a sudden they feel like they don't know me, but they really do know me. So I said to them, they were kind of like, you know, sadness, fear, pity. And so I said, well, you know, bipolar disorder is a mental illness. It's a part of me, but it doesn't define me. It's just like my race or my gender or my ethnicity. I think about it, but I don't think about it all the time. I don't think about it 24/7. And that kind of that made them feel better. And then they asked me serious questions about mental health and for their own family members, but it kind of like, it broke the tension when I said that. I'm like, it's a part of me, but it doesn't define me. I'm still the same person that you taught. I'm still the same person you were eating lunch with 10 minutes ago. You just know one new thing about me.
I had a good discussion about this the other day with someone I was writing, and I was editing a press release about STDs, and they were calling people who have an STD STD carriers, basically STD people. And this is a small nuance, of course, but I think there's a difference in saying a bipolar person or a person with bipolar. Like you were saying, it doesn't define you. It's part of something that you're dealing with. It's part of something that helps build your character. I mean, of course, you've naturally learned things and grown from the experience, but it's not all of you. So if you're saying you're a bipolar person, it means that that's your defining characteristic. That's you, as opposed to a person with bipolar, especially and that's how I can relate too, because bipolar, all mental illnesses carry a lot of stigma, just like any kind of sexually transmitted infection or disease does. And so I'm very particular, even though it's small and a small minor detail, I try to explain to folks that, you know, and I think even Gina, you can relate, someone who is disabled, it's the same idea as saying a disabled person or a person with a disability. I mean, again, it's small nuance, but it actually says something entirely different, you know, with just the slight switch of where that information gets placed. So
one of the phrases that helps me, so when people find out what I do for a living, right, so like I was at the airport on my way to speak at a convention, and I carry a cane for the myasthenia gravis, so I'm with other people who are wheelchairs, elderly people, people usually much older than I am, and this elderly woman said, oh, mental illness. She's like, what is that, like bipolar disorder? And I said, yeah, it includes that. And she said, I had a sister with bipolar, and she was, she was very dishonest.
Oh,
She's
geez.
not nice. So one of the phrases that I tell people is, I say, not all blank are blank. Not all people with bipolar are dishonest. Not all people with bipolar are batshit, whatever, excuse me, sorry, excuse my language, I'm so sorry. Not all people with blank are blank. And then with the autoimmune disease, or the myasthenia gravis, it's a little bit different because it can be an invisible illness, and for many people it is. For me, I carry a cane. And I know that there are some people with myasthenia who are in wheelchairs. So there will always be conversations about myasthenia gravis, because everywhere I go, people ask me, they're like, why do you carry a cane? And so we have the same conversation over and over again. And they'll be like, how old are you? You're too young. And so one of the things I've learned with myasthenia gravis, because it's so long and so hard to pronounce, is I use analogies. And I'll tell people to be like, what? That's what the reaction always is, like, what? How, so I say, well, I have an aunt with MS, and we like to say that myasthenia gravis is as fun as MS, but 5 times harder to pronounce.
Right.
That kind of takes the tension out, the humor. It's like, oh, okay, it's not something so scary that I have to be afraid of you and afraid of the discussion.
And I think that's nice.
Kind of what you were saying, though, Jenelle, about the slight nuance in differences. I think one of the things that, for instance, in the autism community, and I suspect that it's really in any special needs community, there is that subtle change in wording that makes a big difference. Whether people want to be called autistic, or someone wants their child autistic versus a child with autism, or a person with autism. And so that it's the same thing. It's the little subtleties really make a big difference. And to what you were saying, Jessica, also the invisible disabilities, along our son's journey, there wasn't always a time where he looked necessarily different. So the same thing, like where you have the cane, and in a way that's kind of a conversation starter, and it kind of opens the door for you to be able to spread some awareness in many forms. There was a time where, and he, still, somewhat today, but my son didn't look like there was anything wrong, if somebody would say wrong, or that he had a diagnosis, or that he was any different than any other kid. And so then when he would have certain behaviors, people certainly would spin their head and look at me like, what kind of parent are you? And can't you get your kid under control? And, why would he do that? And the strange, faces and different things that we would get. And, I don't know if it's the difference now of my skin is thicker and I've been through this longer, but earlier it used to be that I was thankful for summertime, because in summertime my son wears shorts. And in summertime, when he wears shorts, you can see his leg brace. So it was kind of like a kind of signal, if you will, to people, give him a break. Don't give him a little bit of leeway here. He's figuring some things out. Versus in the wintertime, where there was nothing that really looked very different about him, we certainly got the looks. And we didn't have the opportunity to spread awareness in that sense, because there was nothing that would make people ask us questions.
Right, and sometimes it baffles me a little bit. Like, it just seems like even hearing what you gals are saying, it's like everyone's so judgy. Why are random folks so judgy? And when you actually get to know someone, everyone is dealing with something. I think I heard you say that, Gina, at some point in time. Either I was reading it on your website or anyhow, but everyone is dealing with something, and so when you really get to know and even ask somebody what it is, what the troubles and the things that are going on in their life, all of a sudden that they can empathize, because even if it's not the same exact situation, there are a lot of parallels. There are just regardless. And so it's so funny to me, like, why is it that we feel like, because I have a big sticker that's on my car, and my friend has a sticker that's on her car for the STD project, and she gets more people approaching her than I do, but people will approach and say, what's the STD site all about, and I can laugh about it too, and I think it's good to have a little bit of humor and to not be so uber serious, because the topics we're discussing are serious and they have some serious implications and some everyday, very, I guess, I don't know, very depressing things that go along with them. So if we're constantly just a barrage of negativity and sorrowness, then of course we're going to get a lot of pity, and that's not what I'm looking for either. It's more just like we can empathize, and I think it's a great opportunity, like you said too, Gina, to educate, because then it allows for that conversation to happen, even when somebody is saying it to me in a weird way, or they're saying things like, a lot of times people will use clean or dirty as a way to describe someone who's negative or positive for an infection, and that's a no-no. But then as soon as I hear that, I can say, well, actually, we don't use that language, and here's why, and it's okay that you did, because I know you weren't being intentionally trying to offend, and it's just some of that I think probably is unintentional too, even though maybe we're super sensitive about it too. Like you said, you're getting better with it now. You don't necessarily,
No.
I don't think it's not as hard, or you're not hoping for him to wear the shorts and then so everybody knows, because you're just a little bit better at having that embracing for those conversations. What do you think? Do you think there are any additional barriers in having that kind of conversation? I mean, just the judgmental, or how they're going to judge you as a parent. What other kinds of barriers, Gina, have you experienced with your son and your son's condition, in terms of trying to communicate to others what's actually going on with him, or why something's happening wherever it is you're at, whether it's public or with family, that kind of thing?
I think, there's the one part where I don't really worry anymore what somebody thinks about my parenting or what we're doing. I mean, those days are long gone. The days of hoping for, being thankful for summer were so early on in our journey, and we're so far away from those. So as far as parenting goes, I can beat myself up about my own parenting with my neurotypical kids, but I think it's interesting. There's kind of a before and after. So the way, as we began, it was very difficult to be able to explain how our family operated, why we don't go to birthday parties, that it's not that we don't want to hang out with somebody, it's just that we can't under certain circumstances, or we'd have to be at our house, or and that got really difficult to do. That was probably one of the biggest barriers. And then now it's our son has come so far. He is such a remarkable kid. He has come so far, and anyone new who hasn't followed our journey, or who hasn't been with us, since the beginning, it's really confusing for them. They're like, really? He what? And I'm like, just to kind of give him props for, he didn't utter words, and now he's, see how great it is that he's saying 4 sentences to you. That's amazing. And so it's kind of almost completely opposite, but yeah, so I think I think just trying to show how far he's come is
Well,
right
I think
now
that's
hardest.
important too, because what you're saying, or what I'm hearing you say anyways, is that time, I mean, it's so cliche, like time heals all wounds, and I always tell readers who come into my website too, but time and education help, so it's not just time, it's that you are actively pursuing and researching, and part of your capacity of special happens, of course, you're writing about and working with people, so you are learning a lot, and as a result of that, you're more empowered and feeling less worried about any other random kind of opinions that come in. So I think that's a nice message, like naturally, as you work through it, as you learn about your condition, as you I don't know, you learn about it and then know how to basically handle and communicate, the more practice you get in any kind of environment that way, the easier it is. And
Right.
Jessica, you talked about that too, like you've noticed, like especially with something that's stigmatized, and with bipolar, you've experienced some consequences, like you've had people react adversely. Do you consistently get that kind of reaction, or is that few and far between?
It's mixed. I guess I'm just not surprised when, like you said, you develop a thicker skin over time,
Mm-hmm.
and in a weird way, the bipolar disorder, I imagine all of my illnesses as Rocky's opponents. So the bipolar disorder is my oldest foe. It's Apollo Creed. And the myasthenia gravis, I've only had it for 6 years, so it's like it's my Mason Dixon and everything. So having an illness that myasthenia gravis is something that we don't talk about, you know. So you're not going to see a TV show about somebody who does bad things and they call it myasthenia gravis because it's just so rare and people don't understand it. So learning how to explain myasthenia gravis, because I have a cane and it's always going to come up, has helped me more calmly explain the bipolar disorder when it does come up, because I try to treat it just like I do any other illness.
Sure. Right. It's stripping the stigma away even within yourself, so that there isn't, so that you're not perpetuating that or kind of mimicking that outwardly, you know, so that you're saying, no, I just feel like this is just another thing I'm dealing with. Stack it on, you know, like just another, add it to the list. All right. Well, okay, so we're going to switch gears just a little bit, not entirely. We're still talking about conditions, but I want to talk specifically about discussing conditions with healthcare providers, because I think a lot of people out there with any kind of condition either have had some negative experiences and have experienced stigma, or just a lack of information from a provider who just wasn't specialized in the area and didn't know enough about it to really help them effectively. And I think that scares people then, because the number one person you want to trust about any kind of condition or illness or issue you're dealing with is the assumption is that a healthcare provider is going to be the least biased. So I think that it's important to then chat about our experiences in that realm and how to have effective conversations, and if you're not having an effective conversation, what to do about that and where to go and what are your options. So Gina, I'll start with you. Do you talk to, and you said you did kind of already, but do you talk to, the question is, do you talk to healthcare professionals about your son's conditions differently than you would the public? And then if so, how and why, and have you found some unique challenges in discussing your son's conditions with healthcare professionals specifically?
I do speak about it differently. You know, with healthcare providers, I get a lot more in depth. A lot more detailed. Certainly use their jargon, and then put it in my own words versus a neighbor or somebody else who's asking. It'll just be just having a conversation, no jargon necessary kind of thing. Mm-hmm. And then with the healthcare providers, it's interesting. I think both my husband and I probably just get a quick gauge on the provider to see kind of really how, unfortunately, there are some providers that just aren't as invested as maybe they were when they started, or maybe they just are getting their feet wet or they're not sure, and we kind of gauge them that way. Definitely try to let them know, we nothing's really surprising us at this point in time. We have, done all these things. We have our list of things that, we've gone through. We have our timeline of different things that have gone on. But I really try to kind of give a quick synopsis of, who our son is, what he has been through, and then really kind of target it to who the specialist is that I'm talking to. My GI doc doesn't want to know necessarily the behaviorist stuff unless it has to do with some unless I feel like it could possibly have some, a behavior issue is involved in a GI issue, or, talking with an allergist about, well, GI issues, they would kind of go together, but, you kind of really tailor your conversations to what it is that they're looking for, but at the same time kind of give them an overview so that if there is something that really kind of sticks out, that one little thing that if they had known that one little piece of neurology information that would make a difference on what's going on with the GI tract, but yeah, it really depends on the doctor. And some doctors are very engaging, and that's very refreshing, engaging to our son. And some are just really, they just want to shut the book and get going to the next person. So it really, for me, it's kind of an ambiguous answer, but it just depends.
Yeah. Oh, no, that's okay. Sometimes it can, sometimes it does depend on the healthcare professional themselves. So, Jessica, I noticed, I was reading, you have actually experienced some I think, kind of some stigma that had some large implications and repercussions for your health when you had already been diagnosed with bipolar 2. You were trying to get a diagnosis on the physical symptoms that you were experiencing. Can you share a little bit about that experience and kind of what you learned and how that all came to be and how you overcame that, basically? Because, I mean, from what I read, this was life-threatening for you.
Yeah, the myasthenia gravis almost killed me because I was dealing with primary physician and doctors who have a bigoted attitude towards people with mental illnesses. And, you know, somebody said to me the other day that stigma is such a bad word because it takes the sting out of what it is. It's like if you have a doctor, if you see a primary who doesn't have a positive opinion of someone of your race, you probably call that person a racist, you know, and you probably stop seeing them. Or if they're sexist, they're sexist. Well, if somebody has a similar attitude towards people who have a label, whether it's depression, past history of depression or bipolar disorder or some other mental illness, that can be deadly. So in 2008, I was 24, and I went from having one symptom of myasthenia gravis to all the symptoms in 4 months. So I was literally a textbook case. And I started having problems keeping my eyes open. Sometimes people with myasthenia, we have to manually hold our eyes up, and slurred speech, and then I started falling down during exercise, and I was seeing the doctor, and then finally I was climbing up this really long flight of stairs at work. I was a high school debate coach, and I couldn't feel my legs or anything below my waist, and I kept falling and falling and falling. And so while I was there sprawled out on the stairs, I said, oh my gosh, I have a neurological disorder. So, because the mind is saying get up and the body's saying whatever. So that's, you know, it's a neurological disorder.
Right.
So I went and I saw my primary, and this was not the first time I saw her, and I knew something was seriously wrong with me. And she said, you know what, I think you're stressed out. So I insisted on seeing a neurologist, and I said, you know what, life is inherently stressful. If this is just stress, then millions of Americans should be falling down the stairs at school and work. So I insisted on seeing that neurologist, and she right away diagnosed me with myasthenia gravis. It was just so obvious, and she ordered the necessary blood tests, which the primary is supposed to order, and they automatically confirmed that I have myasthenia gravis, and a few days after the diagnosis I was in critical condition because the disease had escalated so quickly, and I was given a 50-50 shot of living, and you know, I'm 30 now. But I guess there are 3 tips, and I talk about this on my website. There's an article, You're Just Stressed Out, Dismissing Symptoms as Fake. First of all, if you're dealing with this kind of discrimination, number 1, it's not your job as a patient when dealing with healthcare professionals for your illness to be an advocate. You need to get a diagnosis, you need to get treatment. So one of the things, I'm watching the final season of Mad Men, and I'm noticing that a lot of the characters who did and said very sexist and racist things in the first few seasons, they've changed, but they don't even know that they've changed. So I don't have 7 seasons or 7 years for a doctor to realize that they need to treat me like an equal human being. You don't have the luxury of time. So people say, well, I'm just trying to educate them. In my experience, a healthcare professional who's treated me like garbage because I have a bipolar diagnosis did not change. They just didn't. So I have a neurologist. I've had her for the past 4 years who's an expert in myasthenia gravis, and she treats me like I'm a human being who deserves dignity and respect. So if you're dealing with someone like that, I wouldn't stick it out. I wouldn't try to, you know, think this person's going to change. But how long? How long is that going to take? Number 2, be persistent. The doctor is blocking, you know, if you have lupus and you need to see a rheumatologist, if you've got, you know, something like myasthenia gravis, you need to see a neurologist. Do whatever it takes to get to that next step. And then finally, the third thing I would say is be discriminating. So this summer I was having problems with last summer, my ears and my nose, and I was terribly afraid of becoming deaf. And it was just a chain reaction of events that started with my autoimmune disease. And when I saw an ENT, we talked a lot about the myasthenia gravis, which could, you know, they could fill up like 2 hours. I didn't mention that I have bipolar disorder because, you know, I'm not going to become deaf from the bipolar disorder, so it's not relevant. And I don't know what his preconceived notions are, if he has any. So be discriminating at times. If it's not relevant, you may not want to share that. If you, or like I'm seeing a physical therapist now for the myasthenia, and he doesn't prescribe any medication. It's just physical therapy. So we've talked about the myasthenia gravis and the polycystic ovarian syndrome. I don't know. He seems like a nice guy, but I've met doctors who seemed like a nice guy until they found out I have bipolar disorder.
Sure.
And I want to be treated like an equal. So, you know.
And do you guys find that you, because Gina, you talked about specialists, and Jessica, you have as well, and I tell people who are looking for help and in diagnoses and or just continued care with a sexually transmitted infection or disease to oftentimes an OBGYN or somebody at like a Planned Parenthood who deals with this kind of thing all of the time, from people from all walks of life. Sometimes are a little bit more, empathetic and a little bit more knowledgeable. They seem to have less misinformation, and they are repeating less of the myths and misconceptions, where I actually get readers coming in and telling me that their doctor told them that they could contract an STD from a toilet seat, which is not possible. So stuff like that, and you know, and it almost makes you like want to shake your head, but usually that's someone who doesn't specialize in that and doesn't specialize in either areas that, like genital kind of things. They don't specialize like an OBGYN would, or somebody who deals with that kind of care like someone at a Planned Parenthood does all the time. So I've found that specialists are less likely to be discriminating and more likely to have more accurate and more thorough information. Do you find that that's true as well?
Absolutely.
I agree. My OBGYN, that you mentioned it, I've been seeing her for years. I mean, the bipolar disorder, I've had that my whole life, and but the polycystic ovarian syndrome, I was diagnosed at 19, and I've been seeing her since I was in my early 20s, and she never treated me any differently because of the bipolar, and she's been pretty calm throughout. My neurologist, who I've been seeing for the past 4 years, she also has no stigma, and she's able to see the myasthenia gravis for what it is. She's not just a neurologist, though. She is a specialist in myasthenia gravis, which is a very misunderstood illness. So I think that helps. That when I went to a prestigious clinic in 2008, and like a world-class prestigious clinic, and I was seen by a neurologist who, he's a general neurologist, and he had a severe, he had a very bigoted attitude towards people with mental illness. And so perhaps if he had known more about myasthenia, then he could see it for exactly what it was. Perhaps not. But so my experience with specialists has been better.
And I like to, both of you guys said, or no, maybe it was just you, Jessica, that I'm an advocate for advocating for yourself, empowering yourself, and saying if you're not agreeing with, or you don't feel like the healthcare professional or you're going to for treatment is giving you the level of care that you're looking for and the information you're looking for, as well as the bedside manner that you're looking for, not everybody jives. And I should also preface and say that this is certainly not an attempt to bash all healthcare professionals, because there's some amazing, wonderful healthcare professionals out there, but not everybody has the same experience, and we're human and inherently flawed. So it's understandable that some healthcare professionals may have some stigmas and some things that they just aren't even aware that are coming through in their practice. So I am a huge advocate of telling people to seek a second, third, fourth, or fifth opinion, however many it takes, until, and I know that that's not always, it's easier said than done with insurance and stuff like that, but as much as you can, get the care that you think that you need, and that and fight for yourself until you do, because nobody else is going to fight for you. You are. You're your strongest, most powerful advocate, and without doing that, you may not get something diagnosed properly. You're going to be diagnosed with stress, and then it's something more, and it's something more serious, and that's problematic. And I'm sure it wasn't the healthcare professional's intention to be poorly and misdiagnosing you, but that is a result of just, you have to seek help elsewhere if they're not giving you the help you need. So I think that's important to let people know that it's okay. I think sometimes people are intimidated when it's a healthcare professional, that they can't either question them, ask them for additional information, or push to see a specialist, and that's okay to do that, because it's your body, your health, and you are your most powerful advocate, and the one who is going to be able to help yourself the most. You know what I mean?
And I think just a note that I wanted to add is that studies have shown that when women with diseases like myasthenia or fibromyalgia or multiple sclerosis or lupus see a doctor reporting physical pain, even women who don't have on paper a history of mental illness, they're more likely to be dismissed as imagining it, or it's all in your head. For some, there's that undercurrent of sexism that still exists. So
It's
that's
actually
something
research
else.
proven,
Yeah,
right?
this is
Right.
statistically proven. So if you're a woman, that's something else to consider. If you're like, wait a minute, my eyes, my ears, my everything is affected, my lungs, but they're telling me I'm crazy. It's something to
Right.
think about.
Right. Right. Gina,
Right.
you mentioned that sometimes too your son's conditions are not always visible or readily apparent when somebody first sees them. Do you find that even like a healthcare professional like a dentist or something like that, if you preface and share with them your son's conditions and where he's at developmentally, do you think do you get more empathy and just better care? How do you deal with that?
I think it's more forewarning for them. That we're coming in and we're not going to be the typical family, and it kind of helps me be able to gauge whether or not they'll be able to handle what, for instance, the dentist, what his reaction is going to be to them.
Mm-hmm.
you know and I think it's very important to make sure that you're finding someone, for yourself or for your child, that you feel like can work with you. We've had one dental area, again bringing up dentists, that we're pretty close to strapping them down and not working through anything, and putting him under every single time he needed dental work, and that does need to happen with some kids, absolutely. But we found another dentist that was able to help us work through things. And so I think for us, it has been that we needed to be as open and honest as we could about what it is that the healthcare provider is going to have to kind of change their approach for, in order to get the information that they need to get, or get whatever procedure done that they need to get done. And so, just like for Jessica, when you pass on the information that needs to be passed on. And with a lot of our son's diagnosis, a lot of that comes out in behavior. So we have to kind of preface, this is what he's going to do, this is what we've seen in the past, this is what we would suggest. After that, let's just go with it and see what happens. But yeah.
And what kind of additional advice do you give when you have, you have a large readership with people who are supporting family members and taking care of loved ones with all different kinds of issues? There is a number of different issues that you're covering on your site, and even you say, I'm not an expert really in any of these, but I've heard about a lot of them, and/or I've even just barely heard about some of them. But please come in and share your story. What have you learned, and what do you share as a result of when people are asking, I don't think that my child is getting diagnosed effectively, or I don't think we're getting the care we need? What do you tell people?
I tell people to do their research is the biggest thing. I know a lot of people say, stay away from the internet, don't research it. I say do, but just take it with a grain of salt. I also say, stay away from some of the, I could call them storefront websites that are just kind of like a fact sheet that's regurgitated over and over again. Get into the deeper meat of what it is that you think. Use some logic. Go back into your doctor and say, okay, this is what you say. This is what I'm thinking. What really makes sense, and what direction can we go in, and who else can I ask? And and then if you're in a practice, let's say, where you have a number of providers, I think even asking some of the front desk, different people like that, they actually will have insight into, if you're really concerned about this, that doctor over there is going to be the one that you should see. And don't be afraid to change the doctors. I mean, it's not a personal thing. This is your child, and your child more times than not can not speak for themselves, and so you have to do that. You're not really there to make friends. You're there to help your kid. So
Right. I think people forget about that too, because they're in a caring profession like healthcare. we forget that it is a profession and we're paying them, and ultimately that is a service that they're providing. And so if we don't feel like we're getting served effectively or appropriately, then it's okay to go someplace else. It's perfectly okay, and it's not necessarily personal. Sometimes it's just not a right fit. The communication isn't great. You know, not everybody is going to jive with everybody in terms of that kind of personal, intimate care.
Right.
And when you're dealing with any kind of specific condition, any kind of, whether it's sexual health related or mental health related, all of these things are very personal, and the level of care and the quality of care can greatly affect or hinder your capabilities going forward, you know, whether it's yours or your son's. So I think that's number one, so important.
And you know, the other part of it is really kind of listening to your gut. I think a large part of going through our son's journey has been us listening to our gut. You know, we were talking about topics that, you know, nobody was addressing. You know, he's not sleeping. Why does he not sleep? Well, you know, we know that they realize they're thinking we're saying, you know, he only sleeps 6 hours a night. And we're saying, no, he hasn't slept for 3 days. He hasn't taken a 15-minute nap. He is not sleeping, and therefore we're not sleeping. And this isn't healthy. This isn't normal. And really keep going until you get the answer. And it took us 5 years of him not sleeping for us to finally literally have a group of people locked in a room, and we're sitting by the door and we're saying, this is all great. We understand all this information that you just gave us. Why does he not sleep? We've hit him with sleeping medications that should, you know, put down a horse, and he's still awake. Why? You know, this is not healthy. He can't work through that. And that was our gut. That was our gut saying, you know, your answers of blaming it on autism or blaming it on cerebral palsy doesn't work for us.
Mm-hmm. Yeah,
And
you wrote online, you have a 200-pound husband, and if he would have been taking the same medication for the sleeping, he would have been knocked out. He would have been comatose, you know.
Exactly.
And they were giving this to your son, saying it was a product of one of his conditions, when really it was an additional condition.
Exactly.
And at 5 years, I didn't remember that you had wrote that it took 5 years. Like, yeah, and I would say too, not to give up. I mean, not to give up on yourself, and not to give up on healthcare professionals, because there are people who care, there are people who will be able to help. I think in general you'll be able to find someone who is able to give you the proper level of care, but like you said, some of it is you have to do your work too. And we have the same issue with people coming to the website. There's a lot of websites that give just that, like, WebMD information, which is good. It just gives you an overview if you're looking to figure out, oh, what's this, you know, and I just didn't know. It gives you a nice quick overview. But when you're talking about living with something long term, and what does that mean for your life, your lifestyle, how does that mean for you going forward? How should you view yourself? How should this affect your personal view of yourself, as well as how do you take in anything that the rest of the world is saying about whatever it is you're dealing with? And that's where doing that research and finding those kinds of resources is going to be most beneficial. It's going to help you then later advocate for yourself too if you need additional continued care. So that makes sense. Okay, well, let's see. We're coming down to our last topic, and I think we're good on time for our last topic. We can't cover all of it. That's okay. This is quite a meaty discussion. We knew it would be pretty meaty going into this. So we're going to switch gears just a touch. We're still talking about taboo conditions, or hard to deal with conditions and illnesses. So the next thought about it is I want to kind of talk about your personal experience and take it a little bit more inward. A lot of people feel a lot of guilt and shame about having conditions, having things that require additional care or consideration, or even kind of like you said, Gina, having to say no to things that some traditional people folks are doing that you can't do, like birthday parties and stuff like that. So the main topic now is that how do you deal with that guilt and shame going forward? And I'm going to let you start. Are there times when you feel guilty about either his conditions and or for the time that you just automatically are spending additionally on him as opposed to with your other two children and your husband, and additional relationships and experiences that get hindered because of what you are working with and how you're supporting your son? Talk about that a little bit.
You know, my husband and I work really hard to try to make sure that we're paying attention to all the kids. we try to make sure that, you know, not everything is, you know, dragging everybody along to go to therapy for our son. So if we can utilize a play date or a, you know, my mom or somebody to just, could you just watch them for an hour so they have something else, they have one-on-one time with you, could you take them to a park or could you do something? And my husband and I split up a lot. Not split up, but we split up. We, you know, one of us will take, you know, the boys somewhere, and one of us will take my daughter somewhere, or one of us will take our son, our oldest son, somewhere, and then, you know, we try to make sure that we're doing the best that we can. I'm pretty sure we're not perfect, but we do work really hard with that. And as far as, you know, inward guilt, I'll tell you that I carried until Jackson had brain surgery 2 years ago, this June, and in the process of doing his workup for that, it was discovered that he had a misdiagnosis. The misdiagnosis being the etiology for what was going on with his brain. So for 9 years, it was determined that he had an intrauterine stroke, which would mean that, for anyone who doesn't know, it would mean that when I was in my first trimester with him, I would have had a blood clot that floated around and stopped his oxygen flow, and it gave him a stroke. And then therefore I was carrying this guilt in my head that everything that's, you know, all of his challenges are my fault. It was my bloodstream that did this to him. I had no idea, you know, but it was still my fault. Mm-hmm. And when we did his workup for his brain surgery, it actually came out that they don't know why that diagnosis was made. There was nothing that was indicating that that was the kind of development that he had an intrauterine stroke. In fact, he just had a malformation. It just never formed correctly, the left half of his brain. And I honestly started crying, and the thought being just a kind of like a sigh of relief. It's not my fault. Mm-hmm. You know, even though logically I knew I didn't do that to him, right. It was a weight that I carried with me for 9 years, and I beat myself up every single day. And so when they said, you know, it just never formed, all that guilt kind of lifted, and that was very freeing. And so I know that there are so many parents out there that carry this guilt with them every time. You know, there's some commercial about did you take this when you were pregnant? Because does your child show these things? If so, you can have a lawsuit or whatever. You know, that really serves nothing but to make people feel guilty for having to having made the choices that they made when they were pregnant or before they were pregnant or any time in their life, that they feel guilty. And there's a lot of people walking around with that guilt, and that's horrible. It's a horrible feeling.
It is. It's awful. Really, it eats you apart. It eats you apart. And Jessica, talk to us too. I'm curious. I'm going a little different than the questions I had listed. So if you're looking like, oh, you're going in a different direction, I'm curious too. Do you feel guilt and shame at all about your conditions, and share with us a little bit about that? Like, do you, and if so, what's been your experience that way?
Well, I don't feel guilt and shame. I mean, I've had practice. Nobody can make you feel less than unless you give them permission. So there's two things I've learned is that, number one, when people insult you for your illness, it's really about them. It's not about you. So between 2008 and 2010, I was bedridden for over a year, and I was on 12 meds. I gained 10 dress sizes. I lost my long black hair. My face was different, and people would insult me about my appearance. And then I remember one day, I was like, this is kind of, I don't know if this is appropriate. I was 26 years old, and this 18-year-old guy was trying to ask me out. And I'm like, that's like, or 17, I'm like, that's jailbait, that's like inappropriate, you know? And then I realized that strangers would compliment me on my appearance, but it was people who knew I was sick and who knew the depth of the illness who would say mean things to me. And so it kind of clicked that everybody who was like that had something that they were insecure about. And so they were insecure about whether it was their appearance or something going on in their life, and so they were projecting those emotions onto me. And the second thing I've learned is that we shouldn't compare ourselves. So we live in an insta-everything society. For some reason, people feel the need to check in. You know, like they're a celebrity. Check in. I met Cheesecake Factory with 8 other friends. Great. So I tell people, and young people, we can tend to feel behind when we have chronic illness, and it's not a race. And I've written that on my blog, 4 tips for dealing with social media depression. Don't compare yourself on your worst day to someone else on their best day. For every status update about, hey, I'm dating someone, I'm in a relationship, people aren't posting status updates of, hey, I've just had a breakup and I'm lying in bed eating potato chips all week. So that,
Right.
don't compare yourself to others.
Mm-hmm. I love that.
Mm-hmm.
I love that, not comparing yourself, as well as, usually is making sure to look at it from the flip side, because it's so easy to internalize something negative, like especially with sexually transmitted infections and diseases. Naturally, they're very taboo, and people want to shame you for it, or you feel shame for it. But it's usually a result of a lack of education, a lack of information about, one, how that was contracted and what that actually means. And so it's more about not internalizing anything that you're hearing, and understanding that usually it's somebody who's also insecure who's projecting that back out. So it's not necessarily it doesn't have to impact you in that kind of realm. Oh, and we're getting down to the last 4 minutes. So I want to ask you two last questions, or one last question for both of you. And we've been kind of talking about some of the negative implications and how this can be hard to talk about these conditions. But I'd like to do what's been the one thing you've been most grateful for? So to wrap it up with something positive. So as a result of all of your experience, your son's conditions, Gina, and your family supporting him, as well as your conditions, Jessica, what's your most positive experience and what you're most grateful for?
Wow, I don't know that I can pick out one. I think the most positive experience has just been having him as our son. He has taught us so much, and to watch how he really teaches other people things. Seeing how our family can rally around us and rally around him and really appreciate him for who he is and how special he really is. And then I think, if I could just add one last one, when you start out, and I'm sure you both have probably experienced this as well, you lose a lot of your friends sometimes. The people that you thought were going to be there for you really kind of turn away.
Amen.
If you're lucky, they fade away and you don't really notice it until you notice it. But usually people just turn away, and sometimes family members turn away. And so out of that, though, eventually you end up being able to surround yourself with people who accept you and accept your family and don't question your decisions and are really curious about what's going on and how's he doing and how are you doing and what can I do, and hey, by the way, do you want to go go out for a glass of wine or whatever it might be. You end up being surrounded with such higher quality people, and I think that all in all, just the people that we're surrounded with has probably been, besides our son, has been the best that has come out of this.
That's fantastic. I concur. I've had both of those experiences, friends and family, and ultimately I think it helps make room for really more rewarding, or just a little bit more solid and more in-depth relationships, and I appreciate that. So yeah, I love that. How about you, Jessica?
So it's hands down my experiences with my nieces and nephews. Even toddlers at such a young age, they know so much about suffering and pain. My nephew Miko, he's 6 now, but since the age of 2, he's been my self-appointed guardian angel / doctor. He will, at just 2, he'd be very intuitive, as with my other nieces and nephews, but he'd see me in pain, and I wasn't even crying or anything, and he'll just put his hand on my arm and sit with me in silence. Or he'll try to tell me a joke to make me laugh, even though he forgot the punchline. They just know so much about suffering, and I've been blessed by their compassion and empathy, and it's made me want to be a more empathetic person. When I hear that somebody's going through something, even if it's not illness, a divorce, a breakup, something traumatic happened to them, I pray for them, and I want to do everything I can to help, and I think that my nieces and nephews are the same way.
Yeah, that's beautiful about children. We don't give them enough credit. I do feel like children are like the largest population of people who are underserved and underappreciated. So in my thoughts too, we're kind of along the same line, that I feel like I've become a much more open-minded and empathetic individual, and I've become an advocate, whereas I don't know if I would have been an advocate in the same capacity. And before I was running the STD project, I was a big advocate for LGBT rights, and then I was a big advocate for PTSD people, veterans and people with PTSD, and so as well as mental health. And that's always been a big component because of my father's experience. And then once my nephew was diagnosed, so all of that has, and I think overall, when anybody comes to me, people come to me with all of their personal stories, and not even sexual health related, and I'm just like the personal health whisperer or something, you know, and because I think they know that at least I'm not going to be judgmental, and so in that sense, I'm quite thankful for that experience. So this has been such a delight, Gina and Jessica. I just feel like we could talk about this for 5 hours.
This was a lot of fun.
It was a lot of fun. It was a lot of fun. I'm going to let Danielle take over, and thank you, gals, so much. It's been my pleasure.
Thank you.
Thank you, Jenelle, for just being an excellent host, and we've enjoyed just being viewers and listening, and you definitely did your homework, and these topics were, like you said, meaty and awesome. We've had some amazing social media back and forth. We've been really excited. The community's been really involved and engaged during the past hour.
Oh, that's exciting.
I just want to back around on that. Definitely check out Jenelle at the STD Project, and check out Jessica at Fashionably Ill and Gina at Special Happens, and you can actually find information about all of them if you email me at community@WEGO Health if you can't locate any of them. Special shout out to Gina for winning our WEGO Health Activist Award for Best in Show blog, and also to Jessica for being a nominee and finalist in several categories, so to be commended for all of that. And I also wanted to loop back around about two things you talked about. One of which is to be your own advocate. I think that really comes up in every roundtable discussion that we've had, how important it is to speak up when sometimes you think that you're not being heard, and to seek out the healthcare provider that is going to listen to you, because that's the most important thing you can do. And to really gain, something else you guys talked about was sort of gaining that perspective and having that support from your community, family, and friends, and kind of seeing that everybody has something going on, which I know a lot of us here at WEGO Health have been, pleasantly surprised to see that everyone has a shared experience, and it's so important to connect to that outlet when you're speaking to somebody else. And I know so many things that you've said and other health activist leaders that I've spoken with in my time here have touched upon something personally or from my family or extended family and friends that, I too have experienced that, me too. And that's why we connect here at WEGO Health. That's why we have this community roundtable and so many other ways to get engaged, because we too have those shared experiences, and there are so many other people who might not have had the opportunity to speak up yet, and we want to give you that platform to advocate for yourself and for others. One other little shout out, since we have an all-lady panel today, is that it is so important as a woman to get proper medical care and treatment, and that so often women who are the ones who are caregivers, not always, but often are caregivers, do not get the appropriate and adequate treatment that they deserve for their medical conditions, and sometimes too often poo-poo the symptoms that they're having. So if you're having a symptom, go to your healthcare provider and get treated. So that's my spiel. Amazing episode. Thank you so much, ladies. Again, email us, community@wegohealth.com, for any questions, or if you want to get involved with us on any of the actual programs we have going on right now through wegohealth.com opportunities, or if you have an idea for new opportunities. Additionally, we're going to be getting this YouTube video up within the next 24 hours, and you can look for it on our social channels and also search by the hashtag WHAG, W-H-A-G. And that's about it. So thank you again, ladies. If there's any final words, shout it out now.
That's it for me.
Nothing. No. Thank you for having me.
Thank you. Thank you for having me, and I'd like to help out in any other way in the future.
Yes.
Absolutely.
Likewise.
You guys were great. You had us on the sensitive side and the laughter side, which is perfect for us. So thank you so much. Have a great evening, everyone.
Thanks,
Thank
you too.
Bye.
Bye.